Welcome to the Ailm Practice Education Series in partnership with Firm Media, delivering concise and impactful insights for aesthetic and specialty medical practices. Your host, Chris Solhonik.
Today, I'm joined by Dr. William Bruno, a board-certified plastic surgeon based in Beverly Hills in West Hollywood. Dr. Bruno, welcome to the show.
Thanks for having me, Chris.
Hey, can you do me a favor and tell our listeners a little bit about yourself, how you ended up in plastic surgery, maybe how you ended up in the Los Angeles area?
Yeah, I've been here for about 21 years in plastic surgery, but I first started in residency doing general surgery. And, during my general surgery, I sort of developed an interest in seeing what was happening with the other specialties like plastic surgery. And we would do consultations, combine cases, let's say, with plastics. And I just found it to be a lot more interesting than general surgery. So I went on to do a plastic surgery residency at Duke University, and I was in North Carolina there for 3 years. And towards the end of that, I realized I enjoyed it. I particularly was drawn to the aesthetic side of plastic surgery, not so much the reconstructive side. And because I had a bit of an artistic background, I used to draw a lot as a child. It kind of drew me into that. And I just wanted to go to a city that had nice weather and it was a large city. So I looked at South Florida and I looked at Southern California, and I ended up in Beverly Hills, West Hollywood. And I've been here since 2004.
Wow. We've known each other for a long time, and maybe 10 or 15 years now. And I didn't know about the background and drawing a lot as a kid. Do you still do anything artistic?
Not outside of plastic surgery, not really. I don't draw, or rarely once in a while paint, but generally not. I used to do a lot of that as a child and a teen, but not really anymore. Don't have the time anymore.
Yeah, I was in the music business for 10 years, and the way I got into the music business was I met a band who came to LA for a record deal, and I was in art school at the time, and they asked me to design their album cover, and then 28 days later I was on tour with them. So and I don't think I picked up a paintbrush until about 5 years ago again. But
wow,
yeah. So similar. Actually, I do some painting as well, and I really enjoy it. I didn't know that about you, so I'm glad that we made that connection.
Yeah.
So the format of the show is for me to ask you 3 questions, and we've already discussed the questions. We plan on talking about the blending of plastic surgery and wellness, which is something that you've been working pretty actively on for several years in your practice, maybe more. I'm really looking forward to hearing about this. I'm going to ask the questions, and they're designed to help us dig into your, what your thinking is around it and your experiences around it, to draw out the most useful information for our listeners to either apply that to their own practices or just sort of know what's out there and what other people are doing in practice. Wellness is beyond a trend these days. People are really looking into taking better care of themselves, I think. And, with the development of GLP-1 medications and things like that, it's becoming more and more attainable for people. So I'm really excited about this. You ready to jump in?
Sure.
Okay, here we go. Many plastic surgeons focus only on surgical outcomes, but you take a much broader view. What led you to integrate wellness, nutrition, and lifestyle strategies into your practice?
For me, it started maybe 7 or so years ago. On a routine blood test, found out I had very elevated cholesterol, and I went through a series of testing. Then I had a calcium scan, which is a CAT scan through the heart, and it shows if you have any calcifications. And I found out I had a significant amount of heart disease or calcifications at that time, which led to further testing and really changed my life into one of at the time, a very plant-based life, almost vegan, not strict, but almost vegan, and really taking note and really specifically looking at my lifestyle in terms of beyond nutrition, how I was sleeping, what kind of exercise, supplements, stress reduction, things like that. And that's what really triggered me to start sharing these ideas and strategies and tactics with my patients. And it even led me to develop a digital course, like an online course on wellness and longevity. So it really all stemmed from a personal health scare. And, over these years, I have been able to stabilize that. I can't say I reversed the heart disease, but I prevented the progression off medications. I was advised to take a statin, to take Lipitor, but I was against that. So without taking that, I was able to do it through lifestyle and, mainly nutrition, sleep, and exercise. So, that's what caused me to develop a passion in that and share it with my patients. I even did a segment, I still do, like Wellness Wednesday on my Instagram, where I share these kind of quick 1 or 2 minute segments and tips with patients. And it really grew from there. So yeah, patients come to me because they want to look better, like they come to any plastic surgeon, but beyond the surgery, I want them to also feel better and live longer. And I think the longevity component is what I learned over the years, and that's what I enjoy now sharing with my patients.
But I mean, you said you had a health scare, and but I've known you for a while, and you weren't terribly unhealthy, right? You cycle to work at times or things like that. I knew those things about
You
you.
know what it is? I think it's, as most Americans, you eat, at least I did, a lot of processed foods. Growing up in the 70s and 80s, that's when all like fast foods was really getting its beginning and taking off, and eating hospital food and eating horrible food and not sleeping properly. So I was never overweight, but on the surface you would think, oh, I'm pretty healthy. But when you start taking a look at these imaging tests and certain biomarkers and blood tests, there's a lot of people who walk around who are a lot unhealthier than you might think. And, that's a message too. It's just everyone needs to be looking at their blood a little bit more closely, including doctors, which were usually bad patients. But honestly, if I didn't do that 7 years ago, because I hadn't had my blood checked in years, I would have probably just continued on eating fast food, processed foods, etc., and not knowing what kind of a toll that was taking on my health.
Sure. Sure. As you know, I lost quite a bit of weight over the last year. And the first question everybody asks is, "Do you feel great?" And my answer was no. It took a long. It's still taking time for 1,800 calorie Chris to feel like 2,800 calorie Chris. So it's an adjustment to figure out what nutrients I need and things like that. You don't just lose the weight and then magically feel better. Skinny doesn't always equate to feeling good.
Right. And,
So I
I
get
think
that.
there are a lot of people who are, this skinny fat, as you might hear, which is, low muscle, higher fat. So there's a lot of people who walk around and in their clothes, they might look healthy, but they're really not. Um, Again, I never really paid close attention to that till about 7+ years ago. And once I did, I really was able to drill down into what was wrong and how to change it and make those daily changes, which became my new lifestyle.
Thank you. I really appreciated that answer. You've developed digital coaching and longevity programs for patients. What role do those play in helping patients achieve long-term results?
I offer those programs to my patients. Not all my surgical patients will enroll in those, although I'm sort of giving them a lot of the basic tips and concepts of those courses. One is a digital course on wellness and longevity. If someone really wants to know, like, how do I live longer? What tactics should I use? Again, surrounding nutrition, sleep, exercise, which diagnostic tests you should be getting and at what age. Because, the top two killers really are heart disease and cancer. So you want to be screening for those or ruling those out. And then beyond that, supplements and social connection, et cetera, and then prescription meds when necessary. And then my other coaching program centers more around improving body composition, helping people lose fat, gain muscle. A lot of the similar principles in nutrition, but more focused on changing the look of your body, which also changes your health. Most people have more muscle and less fat. They're healthier and they live longer. And by the way, they look better. Which there's a lot of overlap there, I think, between wellness and the aesthetics of plastic surgery. So not everyone will enroll in those formally, but they're available, and they're offered to patients who never even come to have plastic surgery with me, just because I have such an interest in the wellness space that I offer that to my patients and I offer it to the general population.
Okay. That's really great. This is interesting because I was slowly gaining weight over the years and almost to the point where maybe I learned to hide it with clothes and even stay thin enough to not feel like I was like my BMI was too high. But then when I really started focusing on it, I look back on those photos and I think, wow, I was massive. And 50 to 60 pounds is a lot of weight to use. Now, I personally, because I've been in this industry a long time, working with plastic surgeons and then around the wellness space and things like that, I feel very fortunate that I was, I had a therapist in my life, a health coach in my life, a personal trainer in my life, and a plastic surgeon in my life, and all these people were my friends. And so my journey was a combination of like medical weight loss and then some health and fitness and then diet and all of that, and it became this like blended process where I look back on it now and I think I don't know that the average person could piece all that together to get the results. And now I'm meeting people like Dr. Johnny Franco and people like that who are like, oh yeah, it's not just about like changing what you eat or not just about exercising, or there's all these different tools you can bolt together to get the results that you want. Do you have any insight on that, or how it's all kind of coming together?
Yeah, I mean, I think, historically, patients just aren't getting enough information from their primary care doctors or their internists, who they might see once a year for 15 minutes, and they'll go over their labs and they'll say, oh, you're okay, and we'll see you next year. I think now people are being a little bit more proactive. I think the messaging is getting out there, whether that's social media or various podcasts. You have like the Huberman podcast and Peter Attia, where I think people are self-educating more and they're getting at-home labs tested and they're bringing this information to their doctors, which I think is great. And I hope to see that trend continue. But yeah, and I think that's where they're piecing it together, because it's not just like, oh, my cholesterol is okay and my blood pressure is okay. That's it. I don't have to do anything else. I'll just wait till my blood's drawn in a year. Whereas now people are getting their blood tests quarterly and they're just taking more of an active role, or maybe they're seeking a functional medicine doctor. Traditional Western doctors like myself, we just don't really, unfortunately, probe that deeply into the root cause of something. Like, what's the root cause? Maybe someone's depressed and that's why it's leading to their obesity, for example. But yeah, I'm very optimistic. I just think it's a slow change, but it's happening, and it's interesting. I feel other countries are ahead of us. Whether it's the food supply, let's say in Europe, which is healthier than here, but I think we're getting there. But I think it's important for people to take a role in their own health. Don't just wait to see your doctor once a year. Like, be more proactive.
Sure. I think you mentioned Europe, right? The way people are eating in other countries. It's interesting to me because I'll go on a vacation with my wife or whatever. I recently, my wife and I rode our bikes across Portugal and Spain, and we, not all the way across, but significant portion. And each morning we got up for our continental breakfast, and in those countries, they just called it food. And in here, to get the same food, we had to go to the organic section and pay, 3 times as much. And then is it really organic, right? So you have all that. So yeah, I do think there's a problem with that. I want to backtrack a little bit. In your answer just before this last question, you said social connections. Is that the phrase you used?
Yeah, social connections, whether that's spouses, family, loved ones. I think there's a lot of value there, like, because it's not like a harder science per se, such as nutrition or sleep now, or exercise, or things you can measure like muscle mass or VO2 max, for cardiorespiratory fitness. I think people don't put enough emphasis on that, but it's been shown people who have more social connections and deeper social connections, and people who volunteer more, people who have faith, they live longer and they live much higher quality lives than people who are, let's say, more isolated or alone. And unfortunately, with modern technology, you see this in teenagers too. They're more isolated. They're on their computers, they're on their phones, and they're actually spending less time together or less time outdoors, which is another topic. But yeah, social connection is sort of in that, one of those pillars, so to speak, I guess you'd say, of longevity. You have your nutrition, your exercise, your sleep, your stress, and social connection. I think it's in there. It doesn't get the attention it deserves, but I'd say it's as important as any of the others.
Yeah, community is a really big deal for me. I know that personally, and it has affected my health over the years. I think, as you know, I was in the music business for 10 years and very social, very connected, very Los Angeles, grew up in that whole environment. And then years later, I got married and my wife owned a house out in the greater Los Angeles area in like a kind of like horse country. And so it was just after 2008. So the economy was upside down. And so we moved out there because we had to basically occupy the space until we could, get the equity up in the home and sort of make a different decision. But we were out there 7 years sort of building on that house and getting it ready to, sell it. And it took a long time for that area to recoup its value or, merge back into where there was equity in the home. And every year I could feel myself, declining mentally and emotionally because I just did not have the social connections that as soon as we sold the house, we moved back to, a small town where I'm very connected to people and, everything changed, lost the weight, so I think I agree 100%.
Yeah, I think it will not only extend your life, but improve the quality of your life. Whereas one is lifespan is how long you live, and then there's health span, which is the quality of your life. And, without community and those other factors, like you mentioned, you might live a long life, but of low quality, which nobody really wants.
I've got one more question for you. You said that surgery can often inspire patients to take better care of themselves. Can you share a patient story that illustrates this connection between transformation and long-term?
Yeah, I recently had a patient who was probably in her early 40s, and she underwent a mommy makeover, which is sort of a classic, breast implants, breast lift, tummy tuck, and some liposuction. Her result of that surgery aesthetically was so good that it inspired her to, start losing weight and to exercise, etc. And I advised that she get a DEXA scan, which is really an easy tool to check your percent body fat, muscle mass, bone density. And it really, inspired her to start working out, like 4 or 5 times a week. And it's interesting because prior to that, she was in a place sort of struggling mentally, struggling with a little bit of depression, not feeling as close to her husband on an intimacy level. And after the surgery, I could see just the way she carries herself into the office for the follow-ups, the clothes that she wears, etc. And, I think that's just one example of the surgery, I think, started it and got her there. That was a big push. But then the other things, like she changed her exercise routine. She started eating more protein. She started focusing on sleep. Like all those things helped improve the quality of her life. So that's one person that comes to mind because, you can make someone look good, but if they're sad deep down inside, then you can't quite say that surgery was a success. I mean, there are other things that come with it, obviously, other than the skin, which is, that's what we work in plastic surgery. But I think it can really do a lot more than just make someone's breast or abdominal area look better. And in that case, I really think it was a transformative procedure.
Yeah, a little bit of success, begets success, right? Like in some cases, that's 100% my story, right? I lost a little weight and I was feeling good about it. And then I was like, oh, well, maybe if I go on this meal plan that my wife was on because she lost a little weight, and then I get on it and all of a sudden I'm getting even better results, right? And then I get down to sort of my ideal body weight and then realize, oh, I don't have all that, I don't have a over 30 BMI now. So if I go to the gym, I'm going to see results faster. So then I was like, okay, I can't wait to go. I don't have to do quite as much to get the results now. And so it's one thing just kept, where, it's hard to get on a treadmill for that long when you have all that sort of extra fat covering the muscle and you don't get to see the results. And,
Yeah, a lot of patients, if they have extra skin like that, it's hard for them to wear certain clothes. So they're always hiding. Yes, as you mentioned, then it's hard to go to the gym or they're not motivated. So they're like, well, why even try? But if you have, let's say, a tummy tuck or liposuction or something like that, it gives you such a push in that direction. And now you're like, okay, now I'm ready. Now I look ready. I feel better. Now I can really participate. Now I can really, whether it's going to a gym or doing, your at-home workouts. And I see that a lot. And that's what, I think that's the power of, some of these plastic surgery procedures that we do, and it's very rewarding.
Just thought of this because of this conversation. I'm assuming there's an ideal or close to ideal sort of BMI or a situation where somebody, say, hypothetically wants liposuction, right? And I'm sure you're looking at them and you're thinking, I can do this and it will take out that fat. But if you went home and you lost a little more weight and you maybe worked out with a trainer for 90 days, you would come and then I would do the surgery and it would be exactly what you wanted. How often do you find yourself in that situation where people maybe, I would assume people are not willing to do it, right? They're like, no, I just want that.
Yeah, right. Some people they're close. Like, to your question, the BMI, if someone's at a BMI of, let's say, 25 to 30, which is kind of between overweight and obese, and they've been struggling and they've been trying, usually that's the kind of person we'll see. And they're like, yeah, I have the stubborn area, which in men might be the lower abdomen, their love handles, and women, it could be their hips or their thighs. I think if they put in the work and they've plateaued, or they may have gotten down to a BMI of 28. Maybe they were 33 and now they've gotten down this low. And then with, counseling, I'll say, yeah, I think this might be the time. Or I'll say, what's your goal weight? If their goal weight is another 15 pounds, I give them that opportunity, try to lose it, diet and exercise, lifestyle, and then maybe return and see, okay, there's like 7 more pounds, I can't do it. Because there is some fat in the body that is resistant to diet and exercise. There's certain receptors, there's these alpha and beta receptors on the fat cells. So there truly is something such as stubborn fat, even though some don't believe that. And if someone has stubborn fat, you can target it with lipo. Like in a man, you can do love handles and lower abdomen, which are classically hard areas. And in a woman, saddlebags, which is the outer thighs. Yeah, I think lipo serves a purpose, but yeah, I wouldn't do lipo on someone who has a BMI of 38 and they're extremely obese, and that lipo isn't going to really put much of a dent into their overall look. But yeah, there are people who are close, and I think what you're asking is, yeah, some of them will try diet and exercise and they can get there and hopefully not need liposuction.
Thank you. I'm so glad you were on the show today. This is our point in the show where I ask you for your Ailm Essential Insight. What is one piece of advice you'd like to leave our listeners with today? Either whether that's your patients or other providers.
What I would say is to anyone really listening is to, with regard to their health and longevity, take action. A lot of times you listen to these podcasts and you hear all these interesting ideas, whether it's hot sauna, cold plunge, a supplement or whatever, and it can sometimes almost become too confusing and distracting. But, and I'm not saying try the fanciest gadget out there or spend a fortune on a home sauna or anything. But what you can do is say, okay, I am going to be intentional about something. I am going to get 6,000 steps a day. I am going to work out 3 times a week with weights. I am going to optimize my sleep. I'm going to get an Oura ring and track my sleep. Or I am going to get my blood tested this month because I haven't got tested, in a year. Like, take action on something, because it's one thing to know all these ideas and have all these cool recommendations, but unless you take action, you won't know where you stand. And part 2 of that answer would be start tracking things, start measuring, start managing, whether it's your cholesterol, your weight, your blood pressure, your hours of sleep, the quality of your sleep, again, on an Oura ring, your step count. Once you're aware of that and you're intentional, you'll make progress. And I would say that, to any provider for their own health, and then they can be better providers to their patients.
I'm really glad that we did this. A lot of times the podcast has guests on it that are consultants or people that are, I like to believe, high-end professionals or voices in the industry for people like you to watch the podcast and gather information so that they can make their practice a little healthier and get through the day a little better, right? As business owners, we all struggle to find solutions, and that was what the practice education series was designed for. But as time goes on, I'm finding that some of the plastic surgeons are just up to some really fun, innovative, and cool stuff. And I'm glad that you're willing to be on the show and talk about this, because I do not walk into very many plastic surgeons' offices. And as you know, I have either friends or colleagues all across the country that are plastic surgeons. We're not often talking about wellness. So I think this is something that's somewhat long overdue, and I really appreciate that you're taking. It doesn't surprise me that it's you either. You have a reputation for having really great bedside manner and caring about your patients. So it seems like a logical next step for you, and I'm really glad that you're making it.
No, thank you. I'm happy to be here and happy to share that. And it's a passion of mine, just as plastic surgery is. I think wellness is, and I try to tell my patients, you don't just want to look better, you want to feel better. And I think all of us want to live longer. Not that people come to their plastic surgeon saying, hey, what can I do to live longer? But why not share that with them? Because I'm a doctor first, the plastic surgeon second.
That's really great insight. And I've known you long enough where you've had some phases where this particular procedure is what I do, and this is the thing that I really enjoy doing and what I'm good at, which I think is great, right? Love what you do, and then watching sort of the evolution as your practice has developed. Like I said, this seems like an absolutely logical step for you. And as you said, it's probably been about 7 years now that you've been working on it. So it's fun watching you get to do the podcasts and all that stuff.
No, thank you. Thank you for having me on the podcast, and congratulations on having this podcast to you.
Yeah. Thank you. Thank you.
Please give us a like and subscribe to stay up to date with the Ailm Practice Education Series.